right, everyone, we are almost there. Welcome to Health Action's very special closing session. I know I just came out of the drug pricing session, which was extremely riveting, and I'm hearing a lot of praise from those who were in the hospital pricing session. So keep letting us know what you liked and what's really resonating with you. Again, this is a very special closing session, and we are going to be hearing from Secretary Javier Becerra, who's with us, and our Executive Director, Frederick Assassi, for a fireside chat. And, first, I just want to say, I really hope that as the two-day conference concludes, everybody's enjoying their conversations, enjoying the content, that you're able to reconnect with old friends, maybe make some new friends. And I'm just so inspired to be a part of this community. And thank you for taking the time out of your busy week and busy schedules to be with us for these 2 days. I hope you all feel recharged and ready to keep up the fight across so many fronts. So I am now going to turn things over to Nikki Pogue, an ardent advocate who's got her own compelling story to share with us. And Nikki is from San Francisco, and as she'll tell you, she's an avid marathoner. So Nikki, please take it away.
Hey everyone, my name is Nikki Pogue, and I'm excited to be here today to introduce a true healthcare champion and a fellow Californian, U.S. Secretary of Health and Human Services, Javier Becerra. Like so many Americans, I received a surprise medical bill in 2019. I had just run a high altitude race with a chest cold, and I was dizzy and having trouble breathing. So out of an abundance of caution, I went to the closest ER. After a few tests, I was discharged with a diagnosis of viral syndrome, and thankfully, I fully recovered. About a month later, I received a bill for $13,000. And because the hospital was out of my insurance network, I was on the hook to pay more than $10,000 out of my own pocket. I'm sure most everyone will agree with me that when you're in a health crisis or you're sick and feeling scared, the last thing on your mind is whether or not the closest ER is in your network. Thankfully, health advocates across the country took action in 2020 to protect consumers like me from surprise medical bills. As of January 1st, new federal protections championed by Secretary Becerra and the Biden administration will shield millions of consumers from surprise medical bills, including those from an out-of-network provider or facility. This is huge progress, and I'm so grateful that we have Secretary Becerra leading the charge at HHS to implement this important new law. Throughout his career, Secretary Becerra has made it his priority to help more Americans gain access to quality, affordable healthcare. He served 12 terms in Congress, where he helped craft and pass the Affordable Care Act. And as Attorney General for California, he led the 3-year federal court fight to save the ACA, and with it, the protections for 133 million Americans with pre-existing health conditions. As HHS Secretary, he is carrying out President Biden's vision to build a healthy America and ensure that all Americans have health security and access to the healthcare they need. And now I will turn things over to Frederick Assassi at Families USA for a fireside chat with Secretary Javier Becerra.
Thank you so much, Nikki, for being here and for sharing your experience with all of us. What an example of how healthcare has become too much of a business, and as a result, places the health and the financial security of our families in jeopardy. We all take enormous pride in saying, as you just did, that surprise billing is outlawed. Finally. And of course, Secretary Becerra, we are thrilled to have you in this fight alongside us. Indulge me in saying a little bit more about your amazing record. You have been a longtime friend, ally, and champion of Families USA, and so many of our partners that are here today. We've had the privilege of working with you as a member of Congress, as an Attorney General of California, to pass, implement, and defend the Affordable Care Act. In fact, when I was helping to draft the ACA in the Senate more than a decade ago, I remember several trips across the Capitol Rotunda to meet with you or your senior staff, and you truly were a hero for so many of us. And as AG of California, you were one of the most active to use the power of the Attorney General to take on healthcare industry abuses, most notably the price gouging by Sutter Health's monopoly. And now, as Secretary of HHS, you've been so busy already fighting hard to leverage the power of the department to protect and improve the lives of the most vulnerable. For example, just a couple of days ago, you announced a really important interagency effort and millions of dollars to support reproductive rights as we watch Roe v. Wade under assault. You also hold the distinction of being our last in-person Health Action keynote speaker preceded by likes of President Obama and Speaker Pelosi, President Clinton, Senator Warren, Stacey Abrams, and on and on. Your talk in person about grit, guts, and game, and your discussion during the conference of the unfairness and the terrible impact of healthcare monopolies are as true today as they were then. We are such fans, and we are very excited to be working with you now as a key member of President Biden's cabinet. So Secretary Becerra, let's start with, how are you? How was your return to our nation's capital? How's it all going?
Well, Frederick, if I could get that kind of introduction everywhere I went, I'd be really good every day. Maybe it's that you knew that today's my birthday, so you decided to be especially nice, but it is a treat. This is part of my gift to be able to be with all the folks at Families USA again. It's a thrill to you, to Lisa Hunter on your team, to actually everybody on the Families USA team. Thank you for everything you do. To Nikki for her story, for her grit and game and her guts. Thank you. That's what we need. And that's why we've got the No Surprises Act. And that's why we're going to make sure we implement it right. I just have to say, we're going to get these things done. And thanks for being the army we need to make it happen.
You better believe it. And I got to wish you of the happiest of birthdays. It's just, what a fantastic moment to wish you a happy birthday. When you think back on this last year, what are you most proud of so far?
How we're so resilient as a country, certainly our healthcare workers, certainly all those so-called essential workers that weren't being treated well because they were low paid, to every American who took the advice of the experts, the scientists, and believed that these vaccines could work, to everyone who's been doing all the things to take all the precautions. I mean, look, we are a country that seems to be somewhat divided, but I got to tell you, when 250 million Americans get a dose of the vaccine, more than 210 million of them getting the 2 doses, and millions more getting the booster, we're coming together. And I feel good about helping be part of that team to get it done.
Absolutely. And the millions and millions of lives that we've saved together in our work together. And the other side of that coin is the difficult lessons that we've learned through the COVID-19 pandemic, particularly the inequities in our communities, and that dramatically impact the health and well-being of families across the country. And you and I are both Latinx. We're both first generation. I think you on your mom's side, me and both my parents, and have watched the impact of this disease on our family, on our community. President Biden, you both point to the need of improved health equity, racial justice, and better diversity and representation. The theme of this conference is Health Justice Now. What do you see as the most important opportunities in the year ahead to make improvements in racial justice and health equity? And how do we move the dial on a problem that's so deeply rooted in historic injustice?
In a way, we've finally been able to uncover where some of those gaps in our healthcare system, our public health system lie. No one can deny that our healthcare system was too porous. COVID exposed that. So now that we know, and now that we know where some of those gaps are, it's on us to go out there and close those gaps. And that's what we've done. When I came into office less than a year ago, I think it was in May, I got reports that the number of Americans who were receiving vaccines, white Americans that I think at that point in May had received two out of every 3 white Americans had at least 1 shot of one of the vaccines. African Americans, just a little over half, about 54 or so percent. Latino Americans, about 55%. We got to work because, again, those are the gaps. And today, well, at least as of the end of December, the latest numbers that we've gotten, 83% of white Americans have received at least 1 shot. 82% of African Americans now have received at least 1 shot. And Latinos, 84% have received 1 shot. And so we went out there and hustled. It was not easy. It was no accident. That's the kind of stuff we need to do because we can see where the gaps are, and it's on us to make sure we reach out to everyone, go where they are instead of wait for them to come to us.
Beautifully said. I mean, in those numbers, we moved from some very stark inequities to 83% of white Americans, 82% of African Americans, 84% of Latinos. That's really powerful. And we have a big project at Families USA on vaccine equity that we've been doing with the Rockefeller Foundation. We're really proud of, and we take pride in that outcome as well. Another issue that is really near and dear to our hearts, and as I mentioned a few minutes ago, you are no stranger to taking on healthcare pricing abuses and the lack of competition in healthcare markets, as evidenced by your landmark suit as Attorney General of California against Sutter. Now you've been leading implementation of No Surprises Act to protect families from the burden of surprise medical bills. Can you talk a little bit about where you see the greatest need for additional policy change to rein in healthcare costs, improve the value of care, and create healthier competition across the healthcare sector?
I don't think there's any question. Drug pricing.
Yeah.
What we pay in America to get access to medicines, which in some cases cost less abroad than they do here at home, even though they may be invented or manufactured here in this country. And so, without a doubt, because it takes such a big bite out of everyone's pocketbook, pricing, we should not have to pay more than anyone else in the world, especially when there are drugs that we establish here. And what I do think we have to do, though, is recognize that while we can make this happen, it doesn't happen overnight. Our system is a patchwork on healthcare, and it makes it very difficult to come out with a very streamlined approach. But without a doubt, there is no reason why we should be paying thousands of dollars for drugs that other countries are paying a fraction to get.
Yeah, beautifully said. And, one of the things I said often in my testimony in Congress is every day that we let the pharmaceutical companies make a lot of money by just charging outrageous prices is another day we don't get the innovations that we want. We're rewarding, smart lawyers, not smart new drugs. And we got to change that. So we're with you 100%. Another issue that's a really big deal for so many of us is maternal and child health. And so many different parts of your department have different authorities around this issue. What should we know about what's underway to improve this really terrible problem we have with maternal outcomes and just sort of to improve the well-being of children in our nation?
Well, what Americans should know is that we talk the talk, but don't walk our talk when it comes to maternal health. It is incredible to believe that in the wealthiest country in the world with the most sophisticated healthcare anywhere, that we have some of the worst maternal morbidity and mortality outcomes that you can see in not just the industrialized world, but even in developing countries. We rate lower than so many countries in the world when it comes to the outcomes for women and for their babies when it comes to birth. And it's incredible. And I say this not just as someone who has the opportunity to lead HHS, I say this as the spouse of a maternal fetal medicine expert who's been practicing as a perinatologist for over 30 years, or 20 something years. I shouldn't add more years to her age, but she's been an expert in this. And she's talked to me about this for the longest time, how we could actually not only save babies and save moms, but have them be healthier both. That's one of the reasons why at HHS we're investing millions of dollars now to tackle this maternal morbidity and mortality crisis that we face. It's most acute in certain communities, the African American and Native American communities face it hardest. And that's why we're moving forward. We're trying to make sure every state offers through Medicaid a woman 12 months of postpartum care instead of just 60 days. That's going to be really important. We hope more states take us up on that.
So important, and I think that when I've spoken to folks around the country, I think most Americans don't realize that we don't have 12 months of maternity care for a mom right after she's delivered. It's such a common sense, such an important policy, and it's a great example of a reform that we can get going with right away. And it's good to know that at home, you've got an expert who's going to hold your feet to the fire on this and make sure we get this done. So let me give you a final question, which is, you've got an army, truly an army of health advocates ready to go to battle with you and for your agenda. And so when you think about that, what can all of us joining you today do to help drive forward your agenda to improve the health and health equity of our nation?
Well, the most important thing I think I can ask of you and everybody at Families USA is let's keep making the foxhole a little bit bigger. Because we need to have as many warriors as we can find helping us, not just on the issues of maternal health, not just on the issues of COVID and vaccines, but on behavioral health. There's no reason why in America 100,000 people should die from overdose of drugs. We know what we need to do. At HHS, we've taken a new turn. We're moving away from the traditional approach to dealing with drug use disorders. We're casting aside the taboos, the traditions, the not wanting to go into an area because they think it's not the way you should do it, if the science and the evidence shows that it works, we're going to try to save lives. So we're going to do as much as we can, but we need that army. We need people to get out there and help us make sure Congress continues to support our efforts. But more than that, we need folks to be ready, like Nikki was, to tell their story so people understand how important it is that we're all in that foxhole working together to protect each other.
Beautifully said, Mr. Secretary. We got to make that foxhole as big as we can. This is a fight for everyone. And, your example of behavioral health, I think for me personally in my professional work, a lot of us have a passion for finding those folks who've been left behind by society. I don't think there's a better example of a place where we could do so much more to change the lives of people than using the evidence base we have in behavioral health. So it's so inspiring to hear that that's a big focus for you. And we are so deeply appreciative of everything that you and your team are doing to improve the lives of every soul in our nation. So remember, you have an army behind you.
Known it for a long time.
Thanks again, and talk to you very soon.
Look forward to it. Happy New Year.
All right. Well, it sounds like that's a wrap on Health Action Conference 2022. Frederick, that was wonderful. And as just a piece of personal background on me is I'm a Los Angeles native. I have a Chicana mom. To see him in this position is a huge deal. To see a bilingual secretary in this position is humongous. But I thought that was fantastic.
Well, thank you, Lisa. I thought so too. And I think going back to my long ago baseball days, I think we just ran at third base and we're sliding to home plate. And it's a wrap for Health Action 2022. What a terrific 2 days we've had together, Lisa.
Absolutely, Frederick. If we could go ahead and take a look at the visual note taker to see what's being captured there. And by the way, I thought Secretary Becerra summed it up so well when he said that we should not have to pay more than anyone else in the world for prescription drugs. I think that's just because that's where my passion is, but that really resonated with me.
Totally agree. What we are being taken advantage of, and we got to stop it. And the only way we accomplish this goal is making sure that everyone can live their healthiest life is by showing up together.
Yeah, absolutely. And I think that's why we want to thank all of you for taking the time out of your schedule to network, to hear from some amazing and inspiring speakers and strategizing for the year ahead. Over the past 2 days, we've had over 600 people attend this conference. And that's really a testament to how many of us are really in this fight together.
It takes an enormous amount of time and dedication to pull off an event of this size. 600 Army strong, that's wonderful. So Lisa, I want to thank you for leading our team, as well as Lauren Rosenbaum, Adina Marks, Claire Moore, who are all so integral to the success of this conference. And also a big thank you to all the family staff who've been texting and back and forth behind the scenes all the last couple of days, making sure everything goes so smoothly.
Well, thank you, Frederick. It is definitely a team effort, and it takes a village, to mix my metaphors. And I think there's just one last thing that we wanted to ask of all of you before logging off. That is, do not let up. We are so close to getting historic federal healthcare legislation over the finish line.
Lisa, I want to say this out loud. We know that everyone has a little bit of fatigue. We have fought for years to defend the gains we made, and now we have to fight to make even more progress. But this is how change happens. So don't buy too much into the media hype. We heard directly from President Biden yesterday, Speaker Pelosi, Chairperson Murray, and so many of the leaders in Congress, and from Secretary Becerra. Build Back Better is moving. This can happen. From coverage for the most vulnerable in Medicaid non-expansion states, dramatic affordability improvements in the exchanges, to tackling the greed of pharmaceutical companies and the omnibus reforms. They are all in play in Build Back Better. This is one of the most important healthcare bills we've ever drafted, so stay engaged. If you haven't tweeted yet about Build Back Better, or even if you have, go ahead and do it now. And keep it really simple, something like, Congress, time to get #Build Back Better done. And then keep your eyes out for messages and communications from Families USA about other moments that'll be happening in the days and weeks ahead of collective action so that we can get this done.
Yeah, absolutely. And just like so many speakers said earlier today, keep up the fight. And you just heard Secretary Becerra say it, and I know that it's happening in the chat. So many of us have personal stories that brought us to this table, and it is time for us to really amplify that and really bring it forward so that we can see this historical legislation across the finish line. So take that with you for inspiration.
And 2022 is a critical year for action on health justice at all levels, from local school boards to state legislatures to Congress and the White House. And the work that we at Families and all of the folks who are participating right now, the work that we're all doing is critical to creating that nation that families in America deserve. So thank you for being with us at Health Action 2020. And we cannot wait to see you in person, fingers crossed, in person next year. And remember, our greatest honor is to be in service to you. So remember, bring us your hardest problems. That's why we exist. We at Families USA are privileged to be in this fight with you.
Absolutely. Thanks so much, everybody. Take care and stay healthy.